This is the image of a fistula that functions as an ileostomy. It presents challenges attaching a typical ostomy pouch because a stoma does not exist, and in our case, there are creases to each side. Over a period of time and looking at videos like this on YouTube, we have come up with a way to attach an ostomy pouch that works for us. But our approach uses 5 seals around the wound and upwards of 1.5 tubes of paste per change. This process can take anywhere from 90 minutes and up, especially if you run into output coming from the fistula during the change. For that reason, we usually don't eat for about 12 hours before changing the bag, which we do every other day. Sometimes we get 3 days of use out of a bag, but we prefer to change the bag every other morning. This method is far from perfect, and sometimes we change earlier than we'd like to. In a normal month, a 30-day period, we'll have 16 to 18 bag changes. After cleaning and prepping the area, we fill in the side creases with paste, and then apply powder as necessary until we have complete coverage. From there, the first seal is applied over which the ostomy pouch will be placed. If you look closely, you will see that the pouch has slits that have been cut in around the opening to fit down into the wound. Paste is applied to the rest of the seal on the bag itself. With the pouch now in place, the remaining seals are cut into pieces and are placed going around the outside of the original seal to create another layer to help prevent leakage so that you can get a couple of days of use out of it. You might be able to make your setup last longer, as we previously mentioned. With the seals in place, ordinary surgical tape in 1 or 2 inch widths are used to further secure them. Depending on the pouch you use, you may need to make a cut in your tape to accommodate filters. The tape is layered out a few inches from the bag, which helps slow things down a bit when the inevitable happens and a leak begins. Again, when considering this approach, know that the amount of seals and paste required in a 30-day period is far more than what Medicare or your insurance company ordinarily allows. Depending on the vendor, we found that a letter of medical necessity will suffice to request additional supplies, but we've also seen vendors requiring detailed chart notes to make their case to Medicare or your insurance company. Absent that kind of assistance, you'll be spending a lot of money to do this out of pocket every month. Thanks for watching, and good luck in finding what works for you as you manage your situation.